I'm going to cover Axis 1 conditions today. We're talking about post-traumatic stress. When we talk about Axis 1 disorders, we're talking about major disorders that require medication, what we call psychotropic medication, and/or clinical therapy in treating. As we start talking about today, Axis 1 as it relates to post-traumatic stress disorder, we're talking about varying degrees of impairment in functioning that affect a person in the real world. It can affect them based upon their symptoms through duration, frequency, intensity of their symptoms, and it's going to also be there's going to be some learned problem solving. And what I mean by that is, as the individual experiences the symptoms, he or she adapts to their environment in a way that is different prior to the actual traumatic event that occurred. In order to actually be diagnosed with post-traumatic stress disorder, you have to have A and B. A being exposure to the traumatic event through the five senses. B being now the symptoms occur beyond 30 days. And we're going to talk about what some of those symptoms are. When we start looking at the part A, the exposure to the traumatic event, we're looking at all of these people, and these professions are included. Could be anybody that has experienced an abnormal / traumatic event. Could be a car accident, could be, God forbid, some type of domestic situation recurrently, let's say in domestic violence, for example. It could be something outside the norm, such as an illness that a parent or a child or somebody has experienced, and now all of a sudden these symptoms that I'm going to go over start occurring beyond 30 days and at times can intensify. If somebody actually has some of these symptoms but doesn't actually meet the full criteria, does it mean they have PTSD, post-traumatic stress disorder? No. They may have traits of the condition because it's on a spectrum. So some of the things that we have avoidance of things. The individual starts avoiding anything associated with the traumatic event. We could take 9/11 for example. Extremely traumatic event outside the norm and involving the five senses. There were some people that were actually on the ground during 9/11. There were some people that were actually in the building. There were some people that were in planes. There were some people, again, all of us that were away from that event that actually viewed it on TV were also included in there because that involves a visual type of experience, an exposure, if you will. Now, if we start getting into numbing, the person just feels numb because the person hasn't had treatment or has tried to avoid to a point where he or she has developed numbing in levels of what we call detachment. That would be a concern. Somebody that has increased arousal, such as hypervigilance. The hypervigilance is through the roof. They can't even talk about it. They are scanning their environment, looking for threats, depending on what the abnormal event was. Say it involved a shooting. They're just, in a sense, very, very jittery, even just talking about a firearm or talking about or seeing something on TV that relates to gun violence. You have anger outbursts, startle responses that are consistent with the hypervigilance. The anger outbursts are considered some type of reaction towards somebody else. In a fit of anger, they're acting completely on impulse. You have the re-experiencing the event through the hallucinations. Could be auditory, could be visual hallucinations, could be olfactory through the sense of smell. We have the flashbacks, and then last but not least, we have increased substance abuse. The individual now is using substances such as alcohol, maybe prescription drugs, to be able to deal with the trauma. That's it in a nutshell. I'm going to actually come back to this slide in a little bit, but thank you.